Welcome back. The topic we'll discuss in this PowerPoint concerns a single system design, a type of design that you will often use to determine your effectiveness in treating targeted behaviors in individual clients or behaviors of a small group, such as a group for depressed individuals. This design is more often used by practitioners compared with researchers to determine the effectiveness of a specific intervention. For example, we could examine the mean scores of individuals in a depression group. During your undergraduate studies, you learn to assess your client's issues and/or concerns and to plan your intervention, as well as deciding what behaviors to target for change. Using the single system design, you identify the target behavior or the dependent variable. The behaviors must be measurable, and you measure them across time periods. As with any design, the single system design can be modified to address various functions. An exploratory function that describes the behaviors, a descriptive, which looks at the relationship between an intervention and a behavior, and an exploratory function that explains the impact of an intervention on a behavior. Let's start with an exploratory design. For example, using a single system design for an exploratory function, a social worker may examine the anxiety scores as measured by the Beck's Anxiety Inventory across 4 weeks or 4 time periods to formulate an assessment of the anxiety's severity. When we observe the behavior without an intervention, we always call this phase the A phase or baseline phase. The social worker will look at the level of the anxiety or the targeted behavior. The worker will also look at the trend of the anxiety. Is it stable, or does the level of anxiety go up and down, consistently up or consistently down? Sometimes it is unethical for us to wait and conduct a baseline when symptoms are too severe. In this case, the social worker would want to institute an intervention right away. The first type of intervention is referred to as the B phase. Again, the worker monitors the magnitude or severity of the behavior or symptoms as well as the trend or stability of the behavior or symptoms. The problem with this design is that we cannot determine if the intervention is working, as we do not have a baseline to compare to the B phase or intervention phase. There may be different stages of one type of an intervention that the worker will use, using strategies one at a time. For example, we may use CBT and use a strategy to stop cognitive distorted thinking. We would refer to this as phase B. After completing that strategy, the worker may stop that strategy and start an additional CBT strategy, and they would refer to that as B1. If the worker stopped the second strategy and started a third CBT strategy, they would start a B2 phase. Again, they would not be able to determine if the intervention was effective in changing the behaviors due to the absence of the baseline behaviors. Yet the social worker might be able to determine if one strategy worked better than another. Sometimes the worker will use 2 strategies at one time. For example, the worker may immediately institute 2 types of CBT strategies as indicated by BB1. Workers often use several types of interventions at one time. For example, a worker may institute concurrent cognitive therapy and behavioral therapy. This would be indicated as BC, as B would indicate the intervention of cognitive therapy and the concurrent behavioral therapy as indicated by C. As the worker implements additional and different types of interventions, the next letter of the alphabet indicates an additional and separate type of intervention. Again, the disadvantage is that the worker does not have a baseline phase of targeted behaviors to compare to the intervention phase. Descriptive single system designs, or case-level designs as they are often called, will show a relationship between the baseline phase and the intervention phase. Therefore, we have an A phase showing the levels of the targeted behaviors without the intervention, followed by a B phase, or the phase when the intervention is implemented. The advantage is that we can compare the difference in the behaviors from the baseline with those during the intervention. However, without doing another A phase after the B phase, or intervention phase, we cannot say that the intervention explains the impact on the behaviors being monitored. Here's an example of a graph of anxiety scores monitored during an A phase and B phase. To interpret our findings, we would interpret each phase separately, providing information about the magnitude or level of the scores at the beginning of the phase and at the end of the phase, followed by an interpretation of the trend of the scores. Similar to exploratory single system designs, descriptive designs may employ different types of interventions. The difference between exploratory and descriptive designs is the presence of the baseline phase. Here's an example of a client who monitored his/her anxiety scores at baseline, yet had 3 different types of interventions to assist in alleviating his or her symptoms. Explanatory designs, the most sophisticated of all designs, suggest a causal relationship between the intervention and the targeted behavior. The explanatory single system or case-level design monitors the targeted behaviors with the baseline or A phase, followed by the implementation of the intervention or B phase. The intervention is then removed and is followed by a baseline phase, which causes a reversal to the A phase. Therefore, this design is often called a reversal design or ABA design. We could add the same intervention after the second B phase or add another type of intervention. This graph demonstrates the sequence of reversal ABAB design. As stated previously, the client may necessitate the immediate implementation of an intervention. However, we may do a reversal design in a different sequence, such as BAB, with the intervention first, followed by a baseline of A phase, followed by the intervention or B phase. The advantage is that you can see if the problem improves twice. As with other designs, we may implement more than one type of intervention.